you are a LVN, LPN, RN, or NP, and you're looking to work remotely, you've come to the right place. Hi, my name is Jazzy RN. I've worked remotely for over 9 years in utilization review, and the goal of my channel is to help nurses pivot from the bedside to remote work. 5 days a week, I'll provide you with videos with links to different jobs that hire nurses to work remotely. If you go to the description box below, you'll see links to several companies, actually over 90 companies that hire nurses to work remotely in the US and other countries, as well as a link to resume tips and more. And if you go to the comments box below, you'll also see links to multiple jobs that hire nurses to work remotely. Let's get started. The first company on the list is Curana Health. They are hiring a clinical reviewer, LPN, LVN, RN. This job is full-time. Your work hours are weekdays, 8 a.m. to 5 p.m. Eastern Time, and from 10 a.m. to 7 p.m. Eastern Time, one day every other week as assigned. You must have an active, unrestricted LPN license, LVN license, or RN license from the state where you reside, associate's degree or practical vocational nursing diploma or nursing certificate program in accordance with state requirements, 1 year or more of utilization management or utilization review, medical record abstracting skills, including knowledge of medical record organization, medical terminology and disease processes, and strong clinical assessment and critical thinking skills. The next job with Central Health is a supervisor clinical. This job is full-time. You must have an active Minnesota RN license, associate's or equivalent nursing education required, BSN or related bachelor's degree preferred, at least 3 years supervisory experience in a healthcare field with at least 1 to 3 years review experience required, 2 years recent clinical experience, and previous workload management experience strongly preferred. Oscar Health is hiring a case management nurse. This job is open to candidates who reside in Alabama, Arizona, Arkansas, Colorado, Connecticut, DC, Florida, Georgia, Idaho, Illinois, Indiana, Iowa, Kansas, Kentucky, Maine, Maryland, Massachusetts, Michigan, Minnesota, Missouri, Nevada, New Hampshire, New Jersey, New Mexico, North Carolina, Ohio, Oregon, Pennsylvania, Rhode Island, South Carolina, Tennessee, Texas, Utah, Vermont, and Virginia. The pay for this role is $39.28 to $45.94 per hour. You will also have a monthly vacation accrual at the rate of 15 days per year. You must have an active unrestricted RN license from the United States or active compact multi-state unrestricted license. Ability to obtain additional state licenses to meet business needs. 2+ years of clinical experience to include payor, hospital, outpatient, or community-based management. 1+ years of experience in care coordination and navigation. Bonus points if you have CCM certification, if you're bilingual in Spanish and or Creole reading, writing, speaking, if you have a BSN, and if you have working knowledge of Milliman guidelines. Paradigm is hiring a triage nurse. This job is full-time. Your schedule will be 30 to 40 hours per week, weekday evenings 1 to 2 times per week, every fourth weekend. Remaining shifts would be days, and this includes shift differentials. You must have a current unencumbered compact RN license. Bilingual is preferred, Spanish and English, and you must have a professional licenses or certifications required to meet qualifications for this position must be current, unrestricted, and allow for practice within the state or territory of the United States. ClearLink Partners is hiring a utilization management RN, and you must have a Oregon license. You must have a current unencumbered compact RN license, at least 5 years of acute clinical experience, at least 2 years experience in managed care environment across multiple lines of business. That's Medicare Advantage, Managed Medicaid, dual S&P commercial, HMO and risk contracting experience preferred, in-depth knowledge of current standard of medical practices and insurance benefit structures, excellent oral and written interpersonal or communication, internal or external customer service, organizational multitasking, and teamwork skills, and proficiency in Microsoft Office. And just a FYI, make sure you do add platforms to your resume. That includes, if you know Microsoft Office, of course you should know that, include Cerner, Protouch, Epic, etc. Whatever platforms or software you work on in your current job and your previous jobs, please add that to your resume to make your resume more tech savvy. And another FYI, make sure that you look at the qualifications and the job duties and responsibilities. This gives you a guideline and blueprint into how you should edit your resume. Curana Health is hiring an RN clinical quality coordinator. You must have an active RN license, multi-state compact license preferred, 3 to 5 years clinical nursing experience, preferably in primary care or ambulatory care, experience with quality improvement, clinical audits or compliance activities, strong knowledge of clinical guidelines, quality measures, and regulatory standards, excellent organizational, analytical, and communication skills, ability to manage responsibilities across multiple clinic locations, bonus points if you have a BSN, if you have familiarity with CMS quality programs, HEDIS, or value-based care models, and if you have experience working with electronic health records, and that includes Epic, Cerner, Meditech, Protouch, etc. Thyme Care is hiring an oncology nurse navigator. Your hours will be between 11:30 a.m. to 8 p.m. Eastern Time. You must have an active, unrestricted compact RN license required. Associate's or bachelor's degree is required. Either or, BSN is preferred. Compact plus single state licensure in New York and or Illinois licensure is preferred. Additionally, you must have at least 5 years nursing experience, including 3 years in solid tumor oncology nursing. Certifications include oncology-related certifications such as Oncology Certified Nurse, Advanced Oncology Certified Nurse, Advanced Oncology Certified Nurse Specialist, or Certified Case Manager are required or obtained within 2 years of hire. IntePros is hiring a utilization management nurse, RN. This job pays from 40 to 45 per hour and it is full-time. You must reside in the state of Pennsylvania, New Jersey, or Delaware. You must have an active Pennsylvania RN license required, at least 3 years of acute care hospital experience, post-acute care experience required, prior utilization management, discharge planning, or case management experience preferred. Strong clinical judgment, communication, problem solving, and organizational skills with ability to work independently in a remote, high volume review environment. Cotiviti is hiring a clinical consultant one. This job is full time. You must have an associate's or bachelor's degree in nursing, active and unrestricted license, RN in state of residence, professional certification, coder certification, which includes CPC, CPCH, CPCP, or CCSP, RHIT or RHIA certification is required. 2+ years of clinical experience as an RN, 1 or more years experience in coding validation, 1 or more years experience in coding, including professional and outpatient facilities, 1 or more years of experience in claims adjudication, medical or payment policy or utilization review, working for a managed care or health care insurance company or related experience, and 1 or more years of experience in customer service or client management with a strong focus on healthcare setting. This role can be located anywhere in the continental US, repeating motions that may include the wrists, hands, and our fingers. I'm going to skip some of these bullet points, and the pay for this job is $80,000 to $95,000 per year. Government Employees Health Association is hiring a nurse consultant too. This job is full-time. You must have a BSN and 4 to 6 years of relevant experience, active and good standing RN license, including accountability for maintaining all requirements of licensing post-hire, must be eligible to be licensed in all U.S. states and territories, autonomously able to objectively analyze a variety of information and provide actionable insights for decision making and problem solving, skilled communicator with strong written, verbal, and active listening skills, effectively engaging through modern communication technologies, and experience reviewing complex medical necessity appeals.